Padmaja Rao from Hyderabad, who's going to take the lecture today. To ensure proper representation and effective outreach, 20 vice presidents of states have been appointed, along with 2 vice presidents who represent the 2 major metropolitan cities of Mumbai and Hyderabad. We also have an advisory committee consisting of experienced and dedicated homeopaths like Dr. Geeta Mongia, Dr. Vajanti Nagarkar, and Dr. Neelam Avtar Singh. I am Dr. Alka Parvate, the moderator for today. To tell you a bit about Dr. Padmaja Rao. Dr. Padmaja Rao is a very popular senior homeopath practicing in Hyderabad since 30 years, and today is her 30th anniversary of practicing homeopathy. Congratulations, ma'am. She has studied in Government Homeopathic Medical College, Kadapa, and then in a remote place in Andhra Pradesh, where she has faced various hurdles from fellow doctors, community, and also from the public. But she consistently and patiently has passed through all of them, and she has become a very active member in the college and hospital all through her study period. She finished her FCH fellowship course in advanced homeopathy from MUHS in 2021 and leaped many steps forward in her clinical practice. She finished a certificate course in clinical nutrition in 2020. She now owns an online academy of training female homeopaths, all for free since 10 years. She is, as you all know, she is the mentor of our prestigious group, that is IWHP. And recently, she has also entered into paid teaching platforms. She has even served as a ladies secretary and the finance secretary for IIHP Telangana, permanent member of HM80, that is the Homeopathic Medical Association of Telangana too. Her latest to-do list is that she has been selected by the Indian Army to serve defense people in Jammu near the border, for which she will be moving this month, a month end, and she'll be really doing a great job of service to our country. Congratulations once again, ma'am. Icing on the cake is that she has received a gold medal in chanting Bhagavad Gita and also a diploma in Sanatan Dharma course. And the latest, she has also started learning flute instrument. So wishing her all the best for her baby steps into the everlasting world of music. We cordially invite her to join today's session and discuss today's topic, that is adenomyosis versus endometriosis. Now, today's topic is a little confusing because we lack enough diagnostic tools, and we need to know a bit more about how to diagnose the condition clinically with symptoms. And none other than our mentor, Dr. Padmaja Rao, will be the best person to guide us in all this. Now, before I invite Dr. Padmaja to start off, I want to inform the entire group that the session may extend for say 30 minutes or so more than the stipulated period, because Dr. Padmaja is going to discuss some cases, 7 interesting cases from our practice with different approaches. So please do not miss out on that also. Keep aside all your family tensions and focus on our lecture. Welcome, ma'am. You can begin now.
Thank you, Rachana. So I will just start my sharing, and I need to check this. Yes. So, am I visible or audible?
Yes, ma'am, you are.
Yes. Yeah, thank you so much. Thank you so much for those kind and deliberate words, Dr. Alka. Yeah, I am Dr. V. Padmaja Rao. So presently working as mentor for this prestigious group of iconic women homeopaths Bharat, which really is working selflessly to connect all the women homeopaths all over the world and doing some study work every day. You can see in the group also. So that is why I've been attached to this group and working with this group. And today we are here learning with adenomyosis and endometriosis. Why we need to have this topic first? We'll be learning in the coming slides also. Okay. So first of all, we will, as usual, we will take 20 seconds to pray for our parents, for our mentors, and also Sir Samuel Hahnemann. Please. join your hands with me and say namaste to your parents and mentors. So I take this moment to say namaskar to Sir Samuel Hahnemann and also my mentor, Dr. K. Shivshankar sir, who is a very passionate homeopath. He is still working in his 80s with that great passion towards homeopathy. So I need to learn so much from him. Thank you, sir. So now we will move to our introduction. Okay. So everybody are good. Shall we start? So you can give some thumbs ups and everything in the chat box so that Dr. Alka will let me know everything. Okay. So if you have any doubt, you can right away stop me and you can ask or you can give it in the chat box. Okay. So that we will go to the next step only after you understand that only. Because so many students are joining today. So I have prepared for the introduction slides also. Okay. So here introduction. What is adenomyosis in the first place? So we will learn about adenomyosis, the normal uterus, and then the endometriosis, and we will compare both of them, and we will see the homeopathic part, and in the final, the Mater Medica and the solved cases. Okay, so got it now? So got it. So introduction is adenomyosis is a condition in which the endometrial glands and the stroma present within the endometrium, they will be shifting into the uterine myometrium, leading to an enlarged, tender, boggy uterus. This is the simple definition. How to understand this? So if you see like this, if this is the uterus, so suppose if this is the uterus, okay, so uterus actually will be like this, but we see this is the uterus, okay, so this is the outside part. This is the outside part. This is called the perimetrium, the shape, the shape of the muscle of the uterus, and this is the middle part. This is called the myometrium, the muscle of the uterus. This is a very thick one, and this is called the endometrium. This is the secretory part where the glands will be there, where the menstrual bleeding will be secreted, everything. This is the internal layer of the internal smooth muscle layer of the uterus. So the secretion should come from this area. The muscle, the myometrium, should be helping for the security of the uterus, and the perimetrium, as usual, it is the shape of the uterus, right? This is their general function. But what happens in adenomyosis? The endometrial glands, which are secreted here, they just penetrate into this myometrium. They just penetrate into this myometrium, and they will stay here, and they will secrete from here. So after the period also, the discharge will be seen, causing her a lot of discomfort and pain. So what is adenomyosis basically? Adenomyosis is SMI, and it will always penetrate into the myometrium. Apne andar. So that is what is called autoimmune condition. Generally, autoimmune. When autoimmune will come, when there is a heavy stress is there. That is why these days endometriosis and adenomyosis, they are seen in even young age people also, they are seen. That we will see. So till here you understood, right? So this is the endometrium, this is the myometrium, and this is the perimetrium, the outside part. So
I'm sorry
endometrium.
to bother you, but your voice is echoing a bit.
Echoing?
Yes.
Okay. 1 second, I will check it. No. My, I think I have stopped in my mobile also. No? Is it echoing till now? Even now also?
Slight. I'm able to understand, but at the same time, towards the end, there is a slight echo.
Towards the end, there is a slight echo.
Yeah.
Okay, I'll check that. So you just let me know after 5 minutes. How is that like that? Then I will stop my mobile. So you can see that. Okay. Because I have opened my mobile only to see the chat box and everything. Okay. And okay. Then this is about, I think you have understood, right? The students here. This is the endometrium, this is the myometrium, and this is the perimetrium. You will see the picture also. Okay. Then what? Prevalence. Why would we learn this adenomyosis in the first place? So adenomyosis is roughly 1% of the global female population. But although it can rise up to 10 to 30% of the females facing infertility. जो infertility cases है उसमें 10 to 30% are due to adenomyosis only. But total global female population 1% only is suffering with adenomyosis. But what in India? India, these statistics are a bit very worse. They are reaching about 23.5% of all the gynecological cases, not the infertility, nothing. All the gynecological cases, 23.5% are suffering from adenomyosis only, especially in the 31 to 50-year age group. This is textbook says that it is 31 to 50 years age group, but don't worry about the age. This adenomyosis can come in any age. Today we will see cases from 15 years case also, out of the pair box case also we will see today. Okay, so age is not mandatory, but you just keep it in your mind, that's all. Okay, leading to adenomyosis. Then why is diagnosis delayed? Why we are facing problem with adenomyosis? Because the diagnosis is delayed. So why is the diagnosis delayed? Because symptom overlap with other conditions like endometriosis. So endometriosis or adenomyosis अंडरस्टैंडिंग यहाँ पे अंडरस्टैंडिंग करने के लिए कुछ समय तो लग जाता है. And the uterine fibroids, so everything are there inside the uterus, so pain will be there, bleeding will be there. So is it adenomyosis, is it endometriosis, is it fibroid? So we need to diagnose them, we need to have the scan, so it is delayed. Then adenomyosis is sometimes called as a silent or missed disease. Why we call silent or missed disease? Because what adenomyosis generally has that pain, that acute pain, severe dysmenorrhea. So if any young girl is having dysmenorrhea, what we will say, array, let it be. After marriage, it will be set down. After conception, it will be okay. So that is called spasmodic dysmenorrhea, where the cervix is not opening easily, and cervix is not opening easily, and because of their less amount of hormones or whatever may be the reason, that is why the pain is there while the discharge is passing from the cervix to the vagina, into the vagina. Okay, so but what happened is, but as the age progresses, or whenever she is having intercourse and whenever she is having children, then naturally the cervix will be opened much far wider, so her pain will be reduced or sometimes it is gone. So that is called spasmodic dysmenorrhea. And how would you diagnose spasmodic dysmenorrhea? Spasmodic dysmenorrhea occurs only on the first day or just before starting the period, because the cervix is not opening widely with a less amount of hormones, or it's not yet prepared to that extent, right? So only the first day or in the first few hours, the pain will be there. And when people say that if the discharge is established, the pain will be going, then that is a spasmodic dysmenorrhea. No need to worry much about that. You can stay with painkillers also. Okay. Then what? Adenomyosis means what? The pain will be seen on the second day and third day also. When the discharge is very heavy, pain will be increasing. Then you become alert. If she says that I don't have pain much in the first day, madam, but the pain is very much in the second day, in the third day. Whenever the bleeding is very heavy, the pain is also very heavy. Then you become alerted. It may be adenomyosis or the endometriosis also. Okay, that is one clinical observation we can see. And the other thing, older belief is that women in their 40s and 50s are affected. Yes, anybody? I have some disturbance. Okay, older belief is that women in their 40s or 50s are affected. Okay, echoing maybe due to this. Yes, now it won't be there.
Yes, it's much better, ma'am.
Yes, I forgot about that. Thank you. So, older belief is that women in their 40s or 50s are affected. However, it can affect a lot of younger women also, in their 20s also, and even nulliparous women also. We will see that case also. Okay. Lack of awareness in both the patient and the physician. This is delaying the diagnosis. This is delaying the treatment. Okay. Impacting the quality and life and fertility, infertility issues also. Then what is pathophysiology? Till now, everybody are okay now. So I will explain the physiology. So this is our favorite uterus picture. Okay. So anybody is unmuted, or is it my sound echoing? No, no. So I'm getting slightly disturbance. Okay. So this is about the normal uterus. Just go through all the students. Please focus on this one. This is the perimetrium. the outer area of the uterus, and this is the blue color one. So the blue color, the violet color is the myometrium, the muscle of the uterus, and this is the internal part is the endometrium. Okay, the internal part is the endometrium where the secretions will be happening. Okay, this is the fallopian tube, and this is the ovary, and these are the finger-like projections of the fallopian tube, and this is the ovarian ligament. So this is all the ovarian ligament. This is the fallopian tube. This is the ovary. So this is the blue color valley is the myometrium. Okay, this is the endometrium where the secretion happens, and this narrow area is the cervix, and this is the vagina. Okay, and this is the vagina. So don't go with these words. These are all typos. I beg your pardon for that. And so this is the natural uterus. So till now you are okay. Till now you are okay. Just give a thumbs up so that I can see in my mobile. So till now you are okay. Do you know? Did you know about the uterus? This one? No. If no thumbs ups are coming, I won't focus. I won't be forwarding. Yes, I can see now. Sorry. Further. So this is about the uterus, normal uterus. Then we will see adenomyosis uterus. This is the adenomyosis uterus. See, here it is the, what is this? Here it is the endometrium, the uterus, inner lining. And this is the fallopian tube. This is the ovary. This is the ovarian ligament. Ovaries, ovarian ligament, fallopian tube. Narrow part is the cervix, and this one is the what is this called? Vagina. But here, what are these red color particles? These are the endometrial glands penetrated into the myometrium. You can see this light color part is the myometrium, the muscle of the uterus. And this is all the muscle of the uterus. This is outside perimetrium. This is myometrium, middle one. And this is the internal endometrium. So here, the red color gland should be here inside the endometrium. But here, these are all normal glands are there. Even though the endometrium is functioning normally, there may not be a thickness of the endometrium in adenomyosis. Please note that one. Because the endometrium function is completely normal. Extra to that, the endometrial glands have penetrated into this myometrium. Got it? You can see my indicator, right? Like that. My arrow. You can see my arrow, right? So, like this is the this is called adenomyosis. So, are you well till now? Or shall I explain one more time? Yeah, thank you. Thank you. Then this is the comparison. Someone is joining. So this is the comparative, this one. This is the normal uterus. This is the adenomyosis uterus. Okay. Normal uterus, perimetrium. The blue one is myometrium. The internal one is endometrium. Narrow part is cervix. And this is the vagina. The ovaries, tubes, and so here the adenomyosis. Adenomyosis internal. The endometrium is normal. So the fallopian tubes, the ovaries, the ovarian ligaments, the cervix, the vagina, everybody normal. Apart from all the normal thing, we are having red particles here. That these are the endometrial glands penetrating into the myometrium, muscle of the uterus. So this is about adenomyosis. It looks like this adenomyosis. So you got it now. It should be here. It is penetrating its own muscle and causing problem to its own self. So this is the conflict, no? This is the conflict. So somebody has asked about the conflict. I will explain little later. Please wait. So this is about. Yes. Anybody want this slide? So you got this, now. So you got the differences between. Yes. Then these are the key concepts. Endometrial tissue invades the myometrium. The word invades is very key word for us. Okay. Endometrial tissue is invading the myometrium. And it is repeated bleeding will be there. So inflammation will be there generally. Generally, how the patient will present for us? Period to normal रह जाता है 3 to 5 days. और फर्स्ट डे और सेकेंड डे नॉर्मल रहता है और फिर थर्ड डे फोर्थ डे फिफ्थ डे भी रहता है तो फिफ्थ डे तक बंद हो जाता है देन अगेन आफ्टर सिक्स्थ डे कंप्लीट गैप विल बी देयर सेवेंथ डे और एट्थ डे और नाइन्थ डे some spotting will be seen with acute pain like period bleeding only. Then you suspect about endometriosis or adenomyosis. Okay, you need to have the immediate investigations to be done at that time, or 2 days after the period also the discharge will be seen. That is adenomyosis. For endometriosis, how to recognize that we will see later. Okay. So the repeated bleeding will be there once the period is completely over 5 days. But then the myometrium, the endometrium glands which are invaded into the myometrium, they will start secreting. So again, the period will start after 2 days or 3 days with so much of pain. So inflammation naturally will be there. Uterine enlargement will be there. So here with glands, here penetrating means this will generally bulge, right? This will generally bulge. This is the important symptom in adenomyosis. The uterus will be boggy uterus. Boggy uterus in the sense a bulky uterus and boggy uterus. Bulky means only enlarged uterus. Boggy means that boggy uterus means it will be very much painful in the abdomen. Sometimes we can palpate the uterus from outside also. Okay. Sometimes we can palpate very tender, some very lean patients will be there. So per abdomen also we can feel that the uterus has been enlarged. That is called boggy uterus. Then the increased prostaglandins, the uterus, estrogen, progesterone, naturally they will be increased because the endometrium is very much more in quantity. So they are also increased. That is causing the pain. That is a severe pain and heavy menstrual bleeding. So these are the key concepts of adenomyosis. Then the symptoms of adenomyosis. The classic symptom triad by which we can suspect adenomyosis are the characteristic symptom is heavy bleeding and that too progressive and clotting. Heavy bleeding for 2 to 3 days in between and it is stopped means it's okay. Her hormones are heavy and it is something normal like normal to heavy bleed, heavy painful period. That's all. Normal or heavy painful period should be differentiated from adenomyosis painful period. Okay. So then it is progressive because how would we differentiate? Heavy bleeding, it would be progressive. That means first day se second se jada, second day se third day or jada, third day se fourth day se fifth day. Fifth day need to be stopped, right? So it will be going on increasing unless until you will be interrupting with some medicine. That is the symptom of adenomyosis. And this dysmenorrhea, is this a classic symptom where we can suspect about adenomyosis. Okay. This is the classic symptom, dysmenorrhea. Severe, crampy, worsening with age. This is the symptom we need to know. Worsening with age. What did I say for spasmodic dysmenorrhea? It will decrease as the age progresses, as marital life starts, and as the children conceive, as she conceives children. It will decrease the spasmodic dysmenorrhea. But here, the adenomyosis, it will be worsening with age. That is the main symptom. Whenever the patient says that, बचपन में इतना pain नहीं था, अब ज़्यादा हो रही है. I don't have this much of pain in my childhood or in my early years of puberty, but now the pain is going on increasing. Then that is the symptom where we need to be alert. We need to be alert. Okay. Then enlarged tender uterus or boggy uterus. This is seen on the scan. And then the additional symptom, chronic pelvic pain will be there. Naturally, dyspareunia will be there. That means painful intercourse. And then the low back will be there. And there will be naturally heavy anemia will be there. Anemia is causing fatigue. And fatigue is not the frontliner symptom of adenomyosis. Anemia causes fatigue. Okay. Then infertility or subfertility. Natural subfertility means lesser rate of fertility. Infertility, you know. And then the premenstrual pelvic heaviness. This is also important symptom for homeopaths. How is it is important? Because the premenstrual pelvic heaviness will be there. That means the abdomen will be bloated. The blood, many people will say that 2 to 3 days before period also we will be having bloated abdomen, the gases will be there, constipation will be there, we are moving under 2 to 3 kgs, vajan bhi badh jayegi, and they will be becoming overweight for 2 to 3 kgs just before the periods, and that will be decreased after the discharge is started or after the periods is over. So all these symptoms may be maybe directing us to adenomyosis. Okay. Then what? Till now, you understood about adenomyosis some points. So shall we go forward? All the students? Yes. Thank you. So then the endometriosis. Endometriosis is a chronic inflammatory medical condition. It is chronic inflammatory medical condition. Is a medical condition. Okay, where tissue similar to the lining of the uterus. Tissue similar to the lining of the uterus. It's not the endometrium going outside of the uterus. the tissue similar to the lining of endometrium will be forming outside the uterus, grows outside the uterine cavity. This is the red mark symptom for us, outside the uterine cavity. Adenomyosis inside, in between, that in the myometrium, in the middle layer of the uterus. It won't go outside. Adenomyosis won't go outside. But here endometriosis will be growing outside the uterus. Some endometrial like tissue will be growing there. So it primarily impacts individuals' reproductive age. Reproduction is mainly disturbed by endometriosis and not adenomyosis. Today, I will show you a case where the person is completely having fibroids and completely having adenomyosis. Even then, she conceived and had a baby. Okay. So then this is about endometriosis. Okay, you already have seen the normal uterus. So there is no need to explain about normal uterus now. So this is the endometrial uterus. See where is the endometrium? This is the endometrium. This is the perimetrium, that is the uterus muscle, and this is the myometrium. And narrow part is the cervix, and this is the vagina, right? So here, what are all these red things? These are the ovaries, this is the ovarian fallopian tubes, and this is the ovarian ligament. Okay, so this is the bladder and this is the rectum. So rectum will be back and bladder will be on the front side of the uterus, right? So these are all the endometriotic cysts or endometriosis seen. Wherever it is seen on the uterus, on the ovaries, in the myometrium also seen. Endometriosis is also seen in the myometrium also, and upon the fallopian tubes, upon the endometriosis and pelvic lining. Pelvic lining also it can be seen. Upon the bladder also seen. Upon the rectum also it can be seen. It can be seen on the fallopian tube, on the finger-like projections of the fallopian tube. Anywhere outside the uterus. Anywhere outside the uterus, if the tissue similar like endometrium, if it is seen, then it is called endometriosis. Okay, red colors are the endometriosis lesions. So far, good. So everybody understood about endometriosis? Yes. So now, how it behaves. So ऐसा होने से क्या तकलीफ होता है? What is the problem if that endometriosis like tissue is there outside the uterus? What would be the problem? What is the problem here? So during a normal menstrual cycle, what happened? The uterine lining, that is the endometrium, it gets thickens. And if at all, if it is not, conception is not happened, then it breaks down and it bleeds like natural menstrual bleeding. But in a person with endometriosis, this misplaced. The technical term is misplaced. And what is the technical term I said in adenomyosis? It is invading. It is invading. All the fungi group will be invading, right? The bovista, the agaricus, all are very good medicines for adenomyosis, because that the concept of invading is seen in fungi group more, along with our polycrest. So, but here it is not invading, it is misplaced. We need to see the rubric misplaced. Okay, misplaced. That means it should not be there, but it is there. So that is what is misplaced. The endometrial like tissue behaves exactly as the same way like endometrium. That means the endometrium has been shed away, the period is over, and what happens in adenomyosis? The myometrium glands again will secrete the bleeding, and after the period, 2 to 3 days after the period also, the discharge will be seen. That much is there in adenomyosis. But what in endometriosis? The same way will happen in endometriosis also. But how could that bleeding will come into the uterus, right? However, because this tissue is located outside the uterus, the blood and shed cells have no way to exit the body. So the trapped blood causes surrounding tissues to become inflamed, leading to severe pain, scar tissue or adhesions, and anatomical complications. See here, where does this blood can go? It can't come into the uterus, and it can't come into the cervix, and it can't go through the vagina outside, right? So how does this blood will come into the uterus and it will come out? It can't come outside the body. So here it will be secreted, and here it causes inflammation, and sometimes it may cause adhesions to the rectum and also to the bladder. It may cause adhesions also sometimes, right? So that is why. So what the allopath, our fellow companion will do? So he will do surgery, and he will remove everything, and he will take away all these blood clots and everything like that. He will scrape everything. But what we will do, we will give medicines. So we will see that these clots will be disintegrated on themselves. Disintegrated on themselves. This is what about homeopathy. And we will see that the clots are never formed again. That is called the permanent cure. Okay, got it now? So like that, then the common locations would be the misplaced tissue is most frequently found within the pelvic cavity, not away from the pelvic cavity. Only in very, very rare cases, it is the endometriotic cysts are attached to the colon also. Colon, the first part of the colon and the second part of the colon. 2 to 3 rare cases are there. We will discuss about that in our next sessions. Okay. The ovaries, the naturally is ovaries, where it can form fluid filled cysts called endometriomas, or the famous term is chocolate cysts, because the blood will be very black there in the chocolate color. So we will term it as chocolate cysts. Chocolate cysts are nothing but endometriomas seen upon the ovaries, seen attached upon the ovaries. Then the other natural location is fallopian tubes, and the outer surface of the uterus are the ligaments supporting it. And sometimes the bubble, the bladder, or the rectovaginal space also will be rectovaginal space is also, that means the perineum. There also we will be having these cysts. Then the key clinical symptoms, dysmenorrhea, as usual, dysmenorrhea will be there. But here, how would we differentiate adenomyosis and here? This is exceptionally severe dysmenorrhea. We can feel, we cannot term that like this much of yahan se yahan tak dysmenorrhea ho to adenomyosis, yahan se yahan tak ho to endometriosis. We cannot term like that, but we can see the patient. She will be suffering with exceptionally severe dysmenorrhea, debilitating menstrual cramps, and chronic pelvic pain. Generally, persistent abdominal or lower back pain that occurs outside of a period. This should be noted, okay? Outside of a period. Adenomyosis, what happens? Even after the period also, discharge will be happening. But here what happens in endometriosis, even after the period, discharge is happening at some other place, and it is trapped there, and it can't come out, causing inflammation. So pain will be there. So generally people will say, like at the 14th day, I'll be having severe pain, like just like menstrual cramps. Or after 6 days after the period, I will be having menstrual cramps. And 8 days before period, I will be having menstrual cramps only on that particular day. Then we need to get alert, because this is something not normal. Okay. Then naturally dyspareunia will be there. Pain during or after sexual intercourse. Pain during intercourse is common. After sexual intercourse also, for days together, this dyspareunia will be there. Then we naturally suspect about endometriosis. Okay. Then the painful elimination. Pain felt during bowel movements or urination. So for a lady in her reproductive age, so if she says that constipation, if she says that there is much pain while defecating, even the stool is soft or stool में कुछ तकलीफ नहीं है, and the sensation is also good, but the process of defecating is much painful, and even while the urination is also painful urination. Don't just think that it is completely something like hemorrhoids or something like UTI. Don't just limit yourself till there. You also suspect about endometriosis and go for the necessary investigations. Okay. The painful elimination of the pain felt during bowel movements or urination, typically worst during menstruation. So patients हमें बताते रहते हैं ना, during periods, defecation is very, very painful for me. During periods, urination means बस गया, urine आया तो गया, इतना pain है, इतना pain. So that is the chronic symptom. That is the red mark symptom of endometriosis. Then the infertility, difficulty conceiving due to scar tissue, because endometriosis means we know how it functions and everything. So that is why it is definitely infertility is more in endometriosis than adenomyosis. Inflammation or damage to the reproductive organs also will be there. The ovary can get permanently damaged. So that is what adenomyosis versus endometriosis. Then we will see now. So till now, what we had till now, I will give a small recap. Okay, small recap. What is this? There is a spasmodic dysmenorrhea, because dysmenorrhea is one classic symptom where we will be thinking about adenomyosis or endometriosis. First thing is the pain only. Then only with pain only they will come to us. If there is no pain, only the only the discharge is disturbed, they won't come to us in the first place. So first we need to check about whether it is spasmodic dysmenorrhea. We need to check the age of the person. Then spasmodic dysmenorrhea means the pain starts even before the period, and the pain is decreased when the discharge is completely established. So, but adenomyosis, what adenomyosis says? Adenomyosis, the pain will be increasing progressively. Second say third, third say fourth, fourth say fifth, until unless you intervene with any medicine. And what about endometriosis? Pain will be there even after the period, irrelated to the period. It's not related to the period at all. So in that area also, in that timings also, pain will be there. That is that in that way we can suspect about endometriosis. Okay. Yes. Okay, so this is the comparative picture for adenomyosis and endometrium. See here, we already know about uterus. This is the uterus, this is the internal layer, this is the cervix, and this is the vagina. And these are the myometrium, this is the adenomyosis, these cysts are the adenomyosis cysts invading the myometrium. This is the perimetrium, outer layer of the uterus. This is the middle layer, myometrium. So these are the cysts of adenomyosis, quite inside the uterus. So the endometrium invading its own muscle. This is the inside the uterus. And what about endometriosis here? This is the internal layer, internal endometrium, and this is the cervix, and this is the vagina, ovaries, fallopian tubes, and endometriosis means outside the uterus. Outside the uterus, so many cysts are there, so many swelling, so many blood clots are there. This is called endometriosis. Outside the uterus is endometriosis. Inside the uterus is adenomyosis. So, yeah, tak to okay na? So, you are well and good till here. Okay. So, we have already said about the clinical symptoms also. Now we will see about something about the conflict first. So somebody is asking about the conflict. So what is the uterus to the female? Uterus is a nest to the female. Uterus is a nest. नेक्स्ट जहां पे वो अपनी एग्स कर सकती, हैच कर सकती है, जहां पे वो अपनी प्रोजेनी आ सकती है. सो इट इज लाइक ए बर्ड नेस्ट. बर्ड नेस्ट में क्या होता है? सिक्योरिटी भी होता है, प्रोजेनी भी होता है, रिप्रोडक्शन भी होता है, राइट? So that is, uterus is like a nest to the female. If something happens in her life, some problems will be there, some family issues. That means कभी ऐसा भी हो सकता है कि उसके husband और उसके बेटे भी is not listening to her and she can't control him. But ऐसा चलता है, एक दिन चलता होगा, then that would be a psychosis manifestation. That would manifest as a fibroid inside her nest. So she is feeling some difficulty for her nest, for some obstruction for her nest, this one. So, but she can't control that and chalta rahega. It is not upsetting her at the moment. So that will be manifested as a uterine fibroid. That is a psychotic miasm. Then what about adenomyosis? Adenomyosis, we have already said, it is invading its own muscle. That means the lady who is who knows that iske baad I can't extend myself after this limit, but she will be doing that, sacrificing her own self. She knows that by doing that she can't survive, but still she works for the family like that. Then if she feels like that, only whenever she feels only, the conflict will arise. If at all she does not feel or she doesn't know how to feel also, then there's no problem, no adenomyosis will be there. Okay, if she feels that, oh, I'm extending above, apart from my limits, so I can't do anything, then the adenomyosis will come. That is why it may be psychotic, or sometimes it may be syphilitic also, sometimes it may be autoimmune also. So psychosyphilitic. Okay. And what about endometriosis? All the things, all the family issues, all the marital issues, all the issues with the children, husband, in-laws, away or far away. She can't even deal with them. All haywire, haphazard. Then the endometriosis will maybe, these all could be the complications, conflicts behind the this one. So whenever you see that some conflicts are going through her life, you may suspect that her uterus will be having all these complaints in the future. Like that. Okay, then we can make them sit and we can counsel them. You may be suffering like this, maybe. So then naturally she feels like, yes, Dr. Ruchi. Please text or you
Yes,
please
ma'am.
write it. Yes,
Okay.
yes. Make it fast, na? Make it fast. You are already opened your mic. Make it fast.
Okay, ma'am. So what I was asking was okay, that for endometriosis, you said there are conflicts in the marriage. So what kind of conflicts? And suppose if we see that in an unmarried lady, so what are the conflict was that was I wanted to know.
Whatever I said, uterus is the nest. Marriage is not okay. Okay, please, please mute your mic. So marriage is not necessary. Family is not necessary. Unmarried के लिए भी family रहता है ना. So unmarried because uterus is her nest, her family. Unmarried के लिए family क्या होता है? Parents होते हैं, siblings होते हैं, friends होते हैं. तो उनके हिसाब से तो conflicts आ गए तो if she is not able to, if she feels that all or everything is haywire, I can't do anything for themselves and it is going on like that and I even can't survive with those conflicts, then it could be the conflict, basic conflict for endometriosis. Okay, so now the easy clinical differentiation, I will just go through them. The location is adenomyosis is inside uterine muscle, endometriosis is outside uterus muscle. This is just a recap for us. The age group, you just this is all textbook one, you just don't go through the age group, but just keep it in mind. See, 35 to 50 years is adenomyosis, is the reproductive age, and 20 to 40, that means this is still sharp age, would be the endometriosis. And the uterus size will be enlarged boggy uterus, but endometriosis may uterus may not be enlarged. This is the main symptom. Uterus will be normal only because uterus inside the uterus there are no changes, right? So all the changes are the outside the uterus. So the size of the uterus may not be bulky in endometriosis, and maybe it is quite normal. Only the enlarged, bulky, boggy uterus is in the adenomyosis. Okay. So then the bleeding, heavy menstrual bleeding is common in adenomyosis, but it is menstruation में bleeding इतना ज़्यादा होने की ज़रूरत नहीं है endometriosis में. So the bleeding, the amount of discharge during menstruation may be normal, but outside the period she may be having pain and all other symptoms. That is endometriosis. But in adenomyosis, naturally heavy bleeding will be there, continuing to days together, and pain. Pain, when compared to the pain, diffuse uterine cramps will be there in adenomyosis. Sharp pelvic shooting pain will be there in endometriosis. They can't even survive this pain. Huh? So this pain we need to able to differentiate about the pain. And then infertility is possible in endometriosis. It's not 100%, but here endometriosis is very common cause of infertility. Okay, and dyspareunia is less marked. Here it is more marked. And the pelvic nodules absent, here present sometimes. Okay, pain timing during periods only pain will be there in adenomyosis, but in endometriosis before and during and outside the period, anytime the pain may be there. That is endometriosis. Imaging thickened myometrium in scan, what we will see, the myometrium will be thickened because it is already containing myometrial tissues and also the endometrial tissue. That is why it is thickened, the myometrium. But here we will see in endometriosis scan, we will see ovarian cysts and endometriomas. So this is about the difference. Got it now? Shall we move to the next slide? Got it? Thumbs up, please. Okay, then. Okay, thank you. So then suspect adenoma, when would we, still more some details about adenomyosis. When the woman is above 35 years and when she is multiparous and when heavy bleeding dominates, bleeding should be dominating along with the pain. Enlarged tender uterus and pain worsens progressively. That means जैसे जैसे discharge increase होती जाती है वैसे वैसे pain भी increase होती जाती है. That is adenomyosis, bulky uterus on scan. And suspect endometriosis when the woman is comparatively younger in age. Okay, when the woman is comparatively younger in age and severe infertility is dominating. In adenomyosis, heavy bleeding is dominating. People will come for us with DUB condition, dysfunctional uterine bleeding. But for endometriosis, people will come with for infertility. Then only they will start checking for that. And pain before periods, deeper dyspareunia, painful bladder and bowel symptoms, and endometrioma on scan. Okay. And diagnosis. Clinically, how will we diagnose this? Enlarged boggy uterus, tenderness, menorrhagia, and dysmenorrhea. Heavy bleeding plus heavy pain. And tender uterus, they can't. And one more symptom is spasmodic dysmenorrhea. में क्या होता है? They will generally bend in double, and hot water bag and everything will be relieving them. They generally bend double. That is why we will give Macpherson Polosin for that, right? So generally bending double will be happy amelioration for spasmodic dysmenorrhea, but they can't even touch the abdomen. Nowadays, people will say, the mothers will say, "Oh my God, she can't even. She will not allow us to touch the abdomen and let massaging ke liye bhi she will not say. She will say no, and that is where adenomyosis symptom will come. Okay, and larger uterus. And for the understanding homeopathic perspective, what is the homeopathic understanding here? So somebody is unmuted. Please mute yourself. And so yes, somebody is unmuted. Who is that? Please mute yourself, dear doctors. Okay, then homeopathic understanding. So what is the homeopathic understanding? Hormonal imbalance. We will know about the hormonal imbalance. We will know about the congestive pelvic pathology, the constitutional susceptibility. Here, who is that? Dr. Alka, please check now.
No, it's Dr. Nimmi Torani, Dr. Nooni Parvati.
Okay.
Both of them
Dear
have
doctors,
unmuted.
yeah, Dr. Nimmi and Dr. Parvati, please mute yourself, sir. I request you, please mute yourselves. Thank you. Nimmi madam, your mic is unmuted.
I request Dr.
Dr.
Nimmi to
Alka.
mute yourself.
Dr. Alka, please call Nimmi madam, no? From that. Okay.
Yes.
Okay, then. Thank you, madam. Thank you so much. And okay, so the congestive pathology will be jaise bhi hota hai, hormonal imbalance will be there. Constitutional susceptibility. So this is the point where our understanding goes in very much. By seeing the constitution, by seeing the physical constitution first, like calcarea, fat, flabby, fair, and prolonged bleeding, and first few periods will be after menarche, first 1 year, 2 years will be good, and after that everything goes way. That is calcarea curve, right? So then we can see the susceptibility of the person to go into adenomyosis or into endometriosis even before they land into them, by seeing the conflicts, by seeing by what are the conflicts they are facing in their life. So we can give some constitutional remedies for them and we can decrease the susceptibility. Okay. Then the emotional concomitants. Emotional concomitants will definitely help us. What are the emotional concomitants? I will feel very gloomy before periods. My headache will be increased. So I will cry before periods. I have a patient now these days. She will be so tender in the first day or just before 1 day before periods. She will start crying. And every time she will call me. What I can say? Okay, ma, okay, do some meditation, do something like that. Because I have already given medicine for that. Okay. So then what after immediately the discharge has seen, then everything is normal for her. Like that. That's what they are the emotional concomitant. Sometimes everything is cannot be dealt with medicine. We need to take the other methods also. Then the chronic inflammatory tendency to get chronic inflammation. That also we as homeopaths can find even much before that happens, and we can give our chronic medications also. Okay. So that is about homeopathic perspective. So then we will see some commonly used homeopathic remedies, only one line. Then we will follow to our cases. Okay. Then what generally sepia, we are having some remedies now. Sepia means kya? Anybody can tell these symptoms. Okay. So all the students, I request all the students to sell sepia, bearing down sensation, irritability, and hormonal complaints. Either the estrogen will be increased or the progesterone will be increased, or she may be having unwanted hair, or she may be having hair fall, all the hormonal complaints. And lackasies, left-sided symptoms will be there, congestion, intolerance of tight clothes. In adenomyosis, if we see that there is intolerance of tight clothing around the waist or around the neck also sometimes, then we can discuss about lackasies. But this symptom is not at all seen in the allopathic prescriptions, right? They are not worried about that symptom. But here we are having, in homeopathy, we are having such beautiful concomitant symptoms with which we will be able to treat that dangerous conditions even before they land into complications, right? Then the Sabina. Sabina is profuse bleeding with clots. Okay. So I generally give Sabina for heavy bleeding. Then Telopsy. Beg your pardon. So telepsy is excessive uterine hemorrhage. What is telepsy? Telepsy is excessive uterine hemorrhage. So it will continue excessive. So it's excessive, but it will be continuous. Continuous. Next cycle start हुआ या नहीं?
आपको म्यूट करना.
Dr. Nimi madam, please mute yourself. No? Thank you. So telepsy barsha pe. Nimi madam, do you want to ask any question or what? Are you trying to speak, madam?
Request
No.
Dr. Nim to please mute yourself.
Okay, thank you. So telepsy barsha pastoris is the main indication is menses continues till the next cycle. Okay, that is the grand symptom in telepsy. Then what about belladonna? Belladonna is acute congestion, throbbing pain, red bleeding. Clots may not be there. That is belladonna because acute. Clots formation के लिए कुछ तो time लगेगा ना. इतना time तक belladonna will not be there. So red bleeding, acute throbbing pain is belladonna. Then calcarea carb. Obesity will be there. Profuse menses will be there. And fatigue will be there. These three are very red mark symptoms of calcarea carb. Then murex. Pelvic soreness with heightened sensitivity. That is why murex is very useful in endometriosis. Okay. Pelvic soreness with heightened sensitivity. So all these are some common remedies, some with common indication. So now we will go to our cases. So till now, I think I have discussed some theory, some common points and uncommon points and how to differentiate between adenomyosis and endometriosis, and have seen the homeopathic perspective also, and we have seen the common remedies with one or two concomitant indications also. So now we will go through the cases. Okay, everybody ready? So you can unmute whenever asked to, and you can answer the question, because this would be some interactive session. So we are already till 10 p.m. So I will take 20 to 30 minutes or more. I can't promise. Okay. So then this is a case 1. So you just note the age of the patient and whether married or unmarried and whether any reproduction has happened or not. These 3 points you go on noting. What the textbook says, adenomyosis only occurs in the reproductive age, only after some scar tissue has happened. That means some fibroidectomy has done, some polyp has been removed. With that knife scar tissue, from there adenomyosis will be coming. Like that we used to study in our young age. So naturally acid nitricum, keloid, thiocinaminum will be given. But now the entire picture has been changed. Why? Because we are living in the syphilitic dominated world now, right? We are living in the syphilitic dominated world. There's stress and stress and stress. We don't know what is that stress like, but it is there. Stress is there. And that stress is causing all these symptoms. See, here the age is 21 years. Patient, Miss X is 21 years, unmarried. She has finished her engineering and she is waiting to get a job in Bangalore. She is from Siddipet, Telangana. So that means she has consulted me on phone because I practice in Hyderabad, Telangana, and she is there in Siddipet. So the little far away from Hyderabad. So then her menarche, her case is she came to me for that acute dysmenorrheic pain. Okay. So history is menarche is at 11 years, 5 months. That is quite normal. And the menses is also regular. And her case details are acute abdominal cramps during menses. Pain starts 2 to 2 days before the cycle. So we expected that like spasmodic bhi ho sakta hai. But here is the point. She screams and cries with pain. She screams and cries with pain. Often it would be hard for 2 to 3 other families, other houses. 2-3 घरों को भी ये सुनाई देती है इनकी चिल्लाना. तो लोग सोचते हैं अरे चलो अब इनको पीरियड आ गई, ऐसा इतना ज्यादा चिल्लाते थे. So the amount of that pain we should note that one. Okay, she screams and cries with pain and always says to family people, you are not taking care of me during the pain. Then why did I kept that in quotes? Why did I kept that in quotes? That means that is the homeopathic point we are taking into consideration. Okay, just focus on it. You are not taking care of me during the pain. अरे पेन में कोई क्या करते हैं, अरे इतना पेन हो रहा है, मम्मी ये दे दो, मम्मी वो दे दो, तुम ऐसा कर लो, वो ऐसा कर लो, मैं ये नहीं खा सकती, वो नहीं खा, ऐसा नहीं होता है ना. But she says that you are not taking care of me. So then I thought that this is not fitting here. Okay, chalo, we will discuss with that. We will probe into that line. थोड़ा और probe करेंगे, ऐसा सोची थी. Then the regarding the character of the menses, it's very heavy, dark, clotted menses for 4 to 5 days. Pain is seen since 2 to 3 years more. She's 21 years now. Her menarche started at 11 years 5 months, and after that few cycles are normal, and after that the pain has started. Her pain is there, but since 2 to 3 years the pain is very active. That means before 2 to 3 years her pain is about only spasmodic dysmenorrhea, and since it is 2 to 3 years the pain is going into adenomyosis. This case is of adenomyosis. Okay, so 2 to 3 years. What happened in this 2 to 3 years? This line will be telling us that okay, कुछ तो हो गया ये 2-3 साल में. We need to probe these recent events in her life. इतना तक तो ये लाइन हमें बता देती है होम्योपैथ के लिए. Then hot pack massage aggravates. This is where I said hot pack massaging aggravates. Cold pack is amelioration. But she is a chilly patient. Again, one opposite symptom has come. Okay, she is a chilly patient, but cold pack is amelioration. Naturally, periods में hot pack तो amelioration होता है ना. Hot pack amelioration is spasmodic dysmenorrhea. So I thought that okay, she may be having some more degree of pain. That's all. It could be a spasmodic dysmenorrhea. ऐसा सोच रही थी, but as and when I'm going on taking the case, so I'm suspecting something, and then the case is going on like this. Our physical generals are appetite decreased during menses and does not eat at all for 2 days. Again, some superlative degree. Does not eat at all for 2 days. She will not at all eat it. Only because of fear and anxiety of the pain. No indigestion symptoms here. If at all indigestion symptoms are there, we would have suspected endometriosis. No indigestion symptoms. Only fear and anxiety of the pain. So here, fear and anxiety. So that also have been written in my left column of the case sheet, so that I need to investigate about this, and then takes only bland curd rice after that till menstrual cycle is completed. 2-3 दिन के बाद only bland curd rice लेती है period खत्म हो जाने तक. Every month this is the scene for her. Only sometimes she faces difficult stools, often with pain. Stools are soft only. Thirst is decreased. It explains because she may be generally constipated also. And other symptoms are, she is having other symptoms are heavy sinusitis. She is having X-ray PNS changes also. And her past history is she got appendicectomy at 13 years of age, and she got acute dengue and COVID fever. For that acute dengue fever, she has been admitted to hospital for 2 complete weeks. That much of dengue is severe. And once after the dengue is coming down, she started her menarche. That is also a symptom for us. And then the family history, both grandparents are having BP, sugar, hypothyroid, and paternal grandfather died with cancer lung. Father has psoriasis. So all these are syphilitic conditions necessary for us to have family history. Then here comes the main part, the siblings. So she has one younger sister. Naturally, I asked her, how about your sibling? Immediately she says that younger sister stays in hostel and she stays with parents. I thought that naturally the elder ones should be going to the hostels, right? So I asked her that why is your younger sister is going to hostel? Maybe she is not good here or something like that. I've been probing in that angle. Then what she told, always quarreling, madam. My younger sister is dominating, I will feel for that. But what to do? I need to compromise. There is no other way. I should obey it. So I'll keep silence. I thought that, okay, the homeopathic expression has come here. Till now, all we had seen is blah, 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 about all that, endometriosis, all the pathology. It is not at all useful for us. Or it may be useful for only for the temporary symptoms. To go into chronic, this is the symptom for us. And why I am dealing like this with you? To just understand what approach I need to take. Coincidence, one infertility patient is calling me just now. Okay. So what approach I need to follow For that purpose, I'm discussing you like this with the case. So I'm not giving importance to the heavy, dark, clotted menses, because that is there, no common, nothing common, nothing uncommon. Okay. And she already said that she will not eat during the periods, and she will say continuously say that you are not taking care of me. So these 2 points till now we got. And now what we are getting? Always quarreling. My younger sister is always quarreling, and she is dominating. Younger one is dominating. I feel that for that. But what could I do? I will be compromising. What will you do? We will be asking now. I will be compromising. That's all. There is no other way. I should obey it. So I'll keep silence. They are not allowing me to do my preferences, Priority is given to her. నాకు నచ్చింది ఏమి చేయనివ్వరండి, అంతా వాళ్ళ ఇష్టం వచ్చినట్టే చేయాలి. So this is what not allowing me to do my preferences in Telugu, I have told for my Telugu people. Okay. So I will feel brood and then leave it. ఏం చేస్తాను? ఆలోచిస్తాను. తర్వాత చచ్చినట్టు వదిలేస్తాను. ఇంకేం చేయలేను కదా. This is called ringworm miasm. I will feel, I will brood. But what is there? What is the point there in it? I can't go beyond that. So I'll leave it. Happening. And gaya. That is ringworm miasm. This miasm is there, we can see in sensation method. This regarding this, we will discuss some other time. Okay. Don't bother about that. This is for the other people. Okay. So and very soft natured. Well, while speaking only, I can feel that very soft natured, speaks slowly, easily cries. So what would we think then? Easily crying. Don't see this one, and you let me know. We generally think about pulsatilla, right? Or natter muriaticum, because she is brooding. Coming to our mind, right? But wait, here what is the problem? She is chilly patient. What did you say? She is a chilly patient. Natrum and pulse are hot patients. So it's not suitable. And consolation is aggravation here. And she is chilly. For pulsatilla, consolation is amelioration, right? Here consolation, aggravation. Okay, pulsatilla, natramura deleted. Then what to do? Patient finished her BTech and waiting for a job in Bangalore, and hence very much stressed up, aggravating the presenting complaint of acute dysmenorrhea. So mental stress is increasing, or dysmenorrhea. This is the case. So what would we do now? This is the case. How would we approach now? What would we do now? Before going to the next slide, any other discussions? Just unmute your mic and one after the other, you let me know. We can give you 30 seconds. Make it fast. I don't want to ask anybody. So if anybody have anything in your mind, this is the case. These are the case details. Itna tak mujhe aaya tha, case detail. So what is the next step? What is the next step? Generally, what would you do in your clinics? So I'm asking about early practitioners here who are practicing less than 10 years. What would be your stand after this? You need to be interactive, dear doctors. Padmaja ke class mein hona chahiye. Okay.
Ma'am, if there were any incidents like 3 years back, only the pain has been aggravated. So what were the events that happened in her life that she had any profound being like in sad or
so
any
do you
such
want
events?
to know the events now? You have already got the experience. Then why would you bother about the events?
But
And
still, I
listen
would like to probe there.
No. You would like to probe there, okay. Madam, cyclamen, okay. We are not going to the remedies yet. So we are going to the process. Dr. Seema, so you will be going to the events. Okay. What would we find after the event? See, all of the early practitioners and students, just to remember this one. Homeopaths are not interested in stories, just like Dr. Shankaran sir was telling on the other day in the interview. We are not interested in the stories. We need to take only the experience of the patient in the story. Already we are having her experience here. Then why would we bother about the events there? Yes, Dr. Alka, please.
Ma'am, I'm sorry, it got pressed by mistake.
Okay, no problem. So यहाँ तक मुझे क्या पता चला कि till now I have decided that I need to see the case in different method. So I should not take the case like for the heavy bleeding. So I will be giving what we call Sabina, China, Thalapsy, Hemamillis, or Millifolium, whatever all the bleeding remedies will be given. No? So I should not do the regular method here. So I need to go into the mental complaint. So I'll be probing into that complaints. Okay. So then I have gone through the scan report. So if you can read the scan report here. So the scan report, I will read it for you. This was taken on 3rd June 2024. Okay, 3rd June 2024. It says symptoms of adenomyosis here. It says symptoms of adenomyosis. Impression is adenomyosis. Here, the endometrium is quite normal. Endometrium is quite normal. It's a 6.6 mm only. And the myometrium's morphology is not good. Remember, she is a unmarried woman. So here we can't go through the endometrium much, right? So the myometrium is heterogeneous myometrium is there, linear acoustic shadow is there, symptoms of adenomyosis, features of adenomyosis, and the impression is adenomyosis. That is why she is having that extreme pain. So this is the scan report before treatment. Okay. Then so what was the remedy given? I already said you this is not the normal approach. This is the mental approach. This is the mind approach or sensation approach, which what I will say like. So already some people are with me learning about the kingdoms. So this is the kingdom approach. What would you do? You first let me know whether it is plant, animal, or mineral. That's all. Because your study has been done till that period, till that only. So I won't probe you about the remedy. So you just let me know, whoever are studying with me these days, you just let me know whether this I am taking this as with the kingdoms approach. Okay. So what is this animal, plant, or mineral? Dr. Alka says plant. Dr. Rekha says plant. Okay. Sunita says animal. Ruchi, plant. Okay. Feeling neglected and suppressed. Jenny madam, plant, animal, mineral. Only 3 things I want. Rachita, animal. Okay. So whoever has told, so nobody has told with yes, Dr. Sunita, you are on the right track. Okay. So whoever has told, nobody has told it as a mineral, only plant and animal. Huh? Okay. Whoever has told it as plant, just unmute your mic and let me know. Why did you felt this as plant? Mild, crying, like that. Huh? Yes, Dr. Rekha madam, please let me know now. Why did you felt this as plant? Rekha madam, please unmute very fastly. If you can interact fastly, we can finish up fastly. Okay. Mild, crying, sensitive. Okay. So animals भी crying करते हैं ना. Herbivorous animals भी रहते हैं, mild animals भी रहते हैं. They will also cry ना. But here, what is the main symptom? She is comparing herself with her sibling. And she says that her sibling is dominating. And she says that I don't have any other option. I need to compromise. Right? So that is the first and foremost animal point. मुझे ये रेमेडी लेने में only I took 5 minutes. मेरा पूरा केस टेकिंग 20 to 25 minutes हुआ. रिपोर्ट्स को पढ़ने में 5 to 10 minutes हुआ. And मेरी मेडिसिन सिलेक्शन के लिए I have not even taken 5 minutes time for this. Okay. That is about the kingdom's understanding. This is a animal remedy because it is comparative. Okay, we got animal. What kind of animal? Now this is the real challenge. Which remedy would you like to? Which remedy would you like to? Animals में बहुत सारे है ना, mammals है, ophidia है, सब कुछ है. So if you know only you tell. Otherwise we won't waste time here because I know that you have not gone through those lectures yet. Okay. So here one interesting symptom is there. Lac caninum 200 was the remedy given. Got it? No, it's not a snake, madam. It's not primitive also. Why it's not primitive? Because comparison is very high. Okay. Lac caninum, because she is comparing with family and you have forgotten the symptom. You are not taking care of me. And that during the pain. She is telling the family, na, she is continuously complaining, you are not taking care of me. Nobody will say during the pain. They will be bothered about the pain only. But she started complaining there also. So that is the first symptom of animal kingdom. And that is the comparative system. So, and after comparison, what she is doing? She is suppressing herself. And she is again going through the, that is where, that is called the laccaninum. Laccaninum क्या करती है? करती है, करती है, करती है, भोंगती है, भोंगती है, भोंगती है. जब मास्टर आके शुभ करेगा तो बस हो जाती है ऐसा ऐसा ऐसा. That is lacquering, and always wants the appreciation of the master. It always feels somebody is above me and I am here. That is lacquering, hierarchy. So when she says that my sister is dominating, I need to compromise. That means here like this, you know? So hierarchy, when hierarchy is coming, then that means position hierarchy is coming, we will think about mammals. Okay, we will think about mammals, and there is some other reasons are also there. So when we see the detailed case, we will know about that. But here one interesting symptom is, I will let you know, sometimes the objective symptoms also will be there, right? So actually I thought of laccaninum. I have taken the case in the midnight, 11:30 p.m. or 12:30 p.m. like that. So I thought that I need to write the remedy and I will close the case sheet and I will sleep. So I have written laccaninum and I have kept a question mark. Okay, I kept a question mark. So I still wanted to have some discussion upon that. The next day morning, so oh God, what a coincidence. So whoever have referred this case to me, that doctor only is calling me. So she doesn't know that I'm in the class. Okay, no problem. So the whoever have referred to me, she is a veterinary doctor. The next day morning, she just casually called me and said that, Madam, my referral patients have come to you. I said that, yeah, they have. I have taken their case last night only. I finished that case. Madam, what's the point? Yeah. The sister, she is so mild, no? She's very mild, and then she said that, oh, madam, she is not at all mild. वो बचपन से ऐसी है मैडम, हम तो बचपन से यारी हैं, वो बचपन से ऐसी है, always irritable, pokes the sister, pokes the family, says that you are not taking care of me, you need to give more attention to me. Because of that only, her younger sister has went to the hostel. So this is where I thought that yes, laccaninum would be perfect. Otherwise, I would have given for certain painkillers first, Magfast, Colocin, or for her bleeding, some bleeding remedies first. Then I would have thought of laccaninum as a constitutional remedy. But here, I have selected laccaninum 200, even for the acute and even for the constitution also. So we will see what happens after laccaninum. The next cycle, immediately after laccaninum, she had pain, but she never has taken Meftolspas again. Otherwise, she used to take 7 to 10 tablets in a 5 days cycle. Now, she has not even taken one Meftolspas also. Immediately the next cycle. That means within 2 to 3 weeks of laccaninum 200. Laccaninum 200, 3 doses were given, and daily 1 dose. So after 2 weeks, her regular period has come and she has not even encountered any pain. A little bit of pain is there that has come down with Dismin only. Dismin tablets of omega. So I'll be giving attachedly Dismin tablets also I have given. Thiocinaminum 3x also I have given. But thiocinaminum I have given on the next visits. Okay. So after laccaninum, 2 months after that, so this is the scan. Okay. Scan after treatment. See. Uterus, I'm reading about uterus because all other things are not necessary for us. Uterus, normal in size, 6.3, 2.4, 2.6, 2.8 centimeters, and normal in ecotexture. No focal lesion seen. Endometrial thickness 7 mm. Right ovary normal, left ovary normal. No focal lesion seen. Impression, no sonological abnormality at all. This is called constitutional treatment. Got it? Her acute pain alleviated, her constitutionally also, complete scan became normal. 2-3 saal se, that is why Dr. Seema, I said that there is no point in going through the events before 2 to 3 years, because you already had the experience. Already we are having red mark experience. If at all that experience is not great or not pointing us to any directing us to remedies, then we would have probed into that 2 to 3 years what happened आपको ऐसा. So after so now I knew that now I came to knew that laccananum is a constitutional remedy. Then what we will do in follow-ups? So some other doctors are asking about follow-ups, right? So what will we do in the follow-up? I just given placebo, right? I just given placebo for 2 more months. So I've been seeing, and after 3rd month, she get little pain. Then again, what did I do? Can anybody say? After 3 months, so I'll be giving medicine for 3 months for her. So after 3 months, so she had little bit pain again. तब तक के लिए सब लोग चैन से बैठे थे कि अच्छा चलो एक के महीने में 3 साल से हो रहे हैं, कितने सारे डॉक्टर्स को घूमे थे, कितने एलोपैथिक डॉक्टर्स को घूमे थे हम, तो कुछ नहीं हुआ, होम्योपैथी 1 ही महीने में हो गया. पूरे फैमिली तब तक मेरे पेशेंट्स हो गए, उसकी मदर, उसकी सिस्टर, उसकी ग्रैंड मदर, उसकी आंटी, मैटरनल उसके फादर. That means I had some 7 to 9 patients from their family immediately within 2 weeks, within her first cycle. After her first cycle, or I may say. So that is what is the constitutional treatment से हमें क्या मिलता है. So my question is, after 2 to 3 months, she again had pain, but not that much severe, but she had pain. So what would we do now? What would we do now? Anybody can unmute and tell. It's a very simple question. Otherwise, I will be dragging the time. We have already given laccananum 200, and we have said we have a feeling that that would be the constitutional remedy, and that even served as the acute remedy. And 3 महीने उसके बाद हमने प्लासिबो दिया था, 3 महीने के बाद पेन आया है. Then what would be our stand naturally?
Increase the potency, madam.
Why increasing? We can give the same potency, we can repeat now. Why increasing? He can give the same potency repeated also, right? But naturally, yes.
Miasmatic prescription.
Anti-miasmatic की जरूरत नहीं है अभी, because she is not having a different set of symptoms. Whenever she is calling for a different set of symptoms, then we will think about the intercurrent or anti-miasmatic. And if the miasm is showing, the same symptom is repeating, naturally we will give the same medicine. Second time also we will be repeating in the same potency. But here her emotion is little bit more. Whenever she is encountered the 3rd pain again, she said that, oh my God, ye pain फिर आ गया. I will be going again into the same. Oh my God. Till that time, what happened? She got her seat in Bangalore because she is not able to decide if she is in that stress. After laccananum, she got that clarity even in her mind. She immediately pushed off to Bangalore. Otherwise, she is telling that, oh no, madam, I can't go to Bangalore. I can't stay alone. My mother should come to me. Like that, she is telling only to get the appreciation and attention of the mother. She is not interested in her mother. She wants that attention. That's all. She wants to know that people are attending me. That's all. Okay. And that is why it's not pulsatilla. Pulsatilla wants attention. So here it's want attention only to know that they are attending me. That's all. That is the animal character. Okay. But she immediately pushed off to Bangalore. She stayed single there, and everything on fast forward track within 3 महीने. That is why everybody in the family are cool and calm. तो 3 महीने के बाद एक बार फिर पेन आई. So everybody got alerted again. पेन आई, फिर आई पेन, फिर होम्योपैथी में, अरे चलो होम्योपैथी में फिर पेन आई, होम्योपैथी ड्रग्स के ऐसा हो जा रहा है. Then I thought that immediately I need to cut this, otherwise my other patients will be gone, right? So then I thought that I will be giving laccananum 1 ml. So 1 ml again, 3 doses I have given in the period only, during the period only. This you need to note down. During the period only I have given laccananum 1 ml. Again, the pain has gone. Until date, she is not having any pain and any adenomyosis. And this is her latest scan in March 2026, only to check whether she is having anything. See, this is no sonographic abnormality. The other scan was in 2025. Her first scan was in 2024. And the next scan is in the same year, 2024, November. And this is March 2026, even after 2 years. He is the same person. Okay. Uterus is completely normal, nothing to worry. Left ovary normal, right ovary normal, uterus normal, endometrium, myometrium, ecos are completely normal, cervix is normal, and everything. No sonographic abnormality in March 2026. Got it? Got it, dear doctors? This is our first case. So where we had sensation method approach. Okay, we'll go to the second case. Shall we move to the second case now? I have 7 cases, so please bear with me. I have all the abnormal cases also. Yes, Dr. Smita, thiocinaminum was given in the after 6 months. After when I stopped the lacaninum, so along with the placebo, I have given thiocinaminum 3x, and also I have continued Ferromed 6x for her to level up her anemic levels. Okay, till date she is continuing them. So then this is case 3, sorry, case 2 is a 43 years female, came to me on December 19, 2021. Okay, during the COVID period. Acute pain during menses. She have been referred by another, my patient only. So she is a sister-in-law of my patient. So she told that, madam, my sister-in-law is having this much pain. So can you take the case online? Because that is COVID time. Okay, I can take online. So acute pain during menses, starting 2 days before menses. That means I have not seen the patient. This talk is all happening on phone, no video call, only audio call. Okay. Acute pain during menses, starting 2 days before menses and staying for complete menses, and also extending 2 days after menses. So pain is something different. So I need to get alert. Heavy menses. She is 43 years old. So that is the first point. So heavy menses for 19 days with 5 pads per day. Actually, it is 10 days, I suppose. That was a mistake. It is 10 days with 5 pads per day with clots. Decreased only after allopathic medicines are only if medicines are given, then only the discharge will be decreased. Otherwise, the period will be continued even more than 10 days also. And cycles are also delayed once in 45 to 50 days. Total 2 weeks in a month, she will be suffering with acute pain. 10 days discharge and 2 days pehle and 2 days baad mein pain is continuing. So total 2 weeks in a month, she suffers with pain and she stays on bed. Okay. So history of presenting complaint. She was married at the age of 19 years. Please go through this very seriously. She was married at the age of 19 years and conceived at 21 years only. And she had a healthy male child. Okay. So her first child is having 18 years age now. So he finished his intermediate and he is about to join in engineering in Madurai. So they are about to go there. At that time, she came to me. So after that, she had 3 miscarriages. After the first one, she had first one में कुछ problem ही नहीं हुआ. That is what we need to note the point. Okay. First one में कुछ तकलीफ ही नहीं हुआ. And after that, she had 3 miscarriages, and the 2 3rd month, 5th month, and 6th month, respectively. The age is also first में 3rd month हुआ, 5th month हुआ, 6th month हुआ. That means definitely it may be adeno or endo. So we need to check that. Then appendicectomy and myomectomy. Her past history, already appendicectomy has done. And myomectomy, fibroids also have been surgically removed for her. And chronic anemia is iron is always around 8 only, her hemoglobin. She will be always on iron injection from time to time. Okay. So, and her constant worry, her about mental generals now. Her constant worry of secondary infertility. She is not worried about her miscarriages. She is not worried about her fatigue. She is not worried about her anemia. She is worried about her secondary infertility. अरे दूसरा बेटा नहीं है. I want family. One person I need as companion to my elder son. My family wanted a girl child because girls make good relationships and they will make our hearts broader and our progeny increases, and also we will have people with us. बहुत ज्यादा people चाहिए मुझे. And not that they are a nuclear family. They are a joint family. They are a joint family, and every week all the people will gather. That means she is not facing any loneliness. Even then, she wanted about family. That is the point I have noted. Okay. Doctor advised hysterectomy due to repeated fibroids and miscarriages and adenomyosis. She is having adenomyosis right after her first pregnancy. That is why she is having miscarriages in 3rd and 5th month, 6th months, like that. But she is and after that she developed big fibroids, very big fibroids. 15 mm, 16 mm, 20 mm fibroids are also 2 centimeters, 3 centimeters fibroid also there for her. Okay. So that is why doctor advised that to go for hysterectomy. But she did not listen, and she did not listen because she wanted child. So and she has taken 3 years allopathy medicines. This is what I said. Going beyond the limits of adenomyosis conflict यही है. एलोपैथी में उसका मेडिसिन ईस्ट्रोजन प्रोजेस्टेरोन वो सभी लेने से ये फाइब्रॉइड और भी बढ़ जाएगी, इसकी वीकनेस और भी हो जाएगी, इसकी एज भी बढ़ गई है, 18 साल हो गई है पहले बेटे के लिए अभी. So the first child is about 15 years now. At that time, she has taken 3 years allopathic medicines for infertility and finally delivered a male child in 2017 April after 18 years of her first issue. पहला बेटा 18 साल है, दूसरा बेटा 1 साल का है. Second time also she got a son only. So then naturally what happened? What should have happened? Her conflict may be resolved. She wanted a child. Child तो हो गया. अब इसको सब complaints तो कम होना है. But it did not happen like that. Her adenomyosis, her fibroids are continuously increasing. बच्चे को 2-3 साल होने के बाद it should be lesser, na? So but the complaints are completely increasing. This is where I have stopped a minute, and I thought that why the conflict has been resolved, then why did the complaints not come down? Then the next sentence will answer that. So she suffered mentally when the child is born premature and taken extensive care till 3 to 5 years of that age. दूध भी पिलर से लेके उसको ड्रॉप ऐसा उसको फीड करती थी वो 3 साल तक. इतना केयर, एक्स्ट्रा केयर, वेरी वेरी एक्स्ट्रा. दैट इज a superlative degree care. No mother can take that care like that. इतना केयर ली थी. Then naturally what happens? Her conflict has not been resolved. It is still there. That is why she suffered adenomyosis. Otherwise she may have gone into endometriosis. May have. Already fibroids are there. The conflict is. So the associated symptoms are right lumbar pain, right sided pain. Take this very much. Heavy shopping mania. Always want to buy more for her children. More. That is a psychosis. Children, even though they can't afford. They are not a very big economic family. They are really lower economical zone only. But even then, she wants to go for shopping. She just says that उन लोगों को है तो मेरे भी होना है. That's all. I don't want to be little lesser than my co-sisters, co-brothers, something like that. And her associated symptoms are hair falling, dandruff, cervical spondylitis, arthritis in finger joints, completely losing grip often. And she is not a chilli patient. When asked about modalities, she said that, are you intolerant for winter or summer? Nothing like that, madam, but I am definitely not a chilli patient. So that is what she told. Okay. In all the history, okay, यहाँ तक तो हो गई है. यहाँ तक आपको कुछ ना कुछ आ गई ना, कुछ ना कुछ. So what would be the approach here? What would be the approach here? Anybody? So what would we do now? Excessive care, mineral, Sunita. Okay. And anybody? Very good, Sunita. You are highly reactive. Okay. Anybody? Yes, please.
Mom, I think she's comparing with others.
Okay.
So
Okay.
that's why she is having that extreme care and everything to be utmost thing.
Okay. So what
Otherwise-
is the conclusion? So what is your conclusion?
Yeah, animal kingdom only.
So that means you are telling that I need to go with the kingdom approach.
Yes.
Okay. Again, kingdom approach. Again, an animal will see. So plants are never comparative. Huh? We are having some plants now. Plants are also comparative, madam. But we need to check that whether that is an animal comparison or plant comparison. We will see that also. Okay. So thank you, Rekha madam. And any other. So what I am thinking is, just like Rekha madam has said that, I was about to land into laccaninum. I have written laccaninum in the left column, question mark. Because she is comparative, she is family oriented, she wants children, she is not sufficient with 1 or 2 kids, and she is completely suppressive, and she is this. So I thought that laccaninum. अभी भी हमें laccaninum बहुत कुछ काम किया है पहले भी. Why not we do with laccaninum? So मैंने question mark रख दिया. But what is the next symptom? You see this. in all the history. So I was thinking about Lacanium. I was just scrolling the papers. So these are my case sheets here. Okay, these are my original case sheets. So I was just scrolling through the papers, what I have written, and everything. So I have observed that she says her abdomen is bloated and with easy satiety, even during her pregnancies, even during her miscarriages, even during her menstruation. Then I have noted that as a concomitant for her. Okay, so यहाँ पे हमें एक concomitant भी आ गई. So then I have kept like that. Then I was going through the investigations, the scan abdomen in February 2021. So she came to me in December 2021, but her scan is in February 2021. Because of this COVID, she cannot take the other scan. 8 months before scan, that was it. She came to me before 8 months before she came to me. Hemangioma in the right lobe of the quadrate lobe of the liver. Liver is in the right sided. So note that right-sided one. Okay, hemangioma in the quadrate lobe of the liver. Gallbladder polyp is there. Echoing SOL in mid-pole artery of left kidney. Angiomyolipoma maybe. And here comes bulky uterus. Extensive adenomyosis. Note the word extensive. Because she is already having adenomyosis since her first pregnancy. 18 साल से adenomyosis में है, and she is having fibroids also. And now, even after her child born, her conflict has not been resolved, so the adenomyosis has become extensive. Extensive adenomyosis noted in posterior and anterior walls. Fibroid is about 29 into 15 into 15 mm. That is close to 3 centimeters. Okay. Then, oh, sorry. Then what could be the remedy? You have already seen the remedy. Huh? So, what could be the remedy now? What could be my approach now? I have already told you, na, many symptoms I have told you. That is a very easy thing, na? Right-sided, I have highlighted right-sided. I have highlighted right lobe. Hemangioma in liver, that is in right side. Okay, gallbladder also is affected. Okay, and she says that her abdomen is bloated. Easy satiety. That is the red mark symptom of which remedy? Easy satiety.
Lycopodium.
Yes. Who is that telling? Rekha madam. Lycopodium. So that is lycopodium. So I thought that while I want to go clear this case with the kingdom approach, so I have kept a question mark and I've been waiting. I thought that when such a clear concomitant is there and when such clear sidedness is there and see clear thermals are there, that she is not a chilli and her shopping mania, she wanted to be above. She will be shopping only to be seen more than the other people. So this is what is animal like आपको लगा, लेकिन this is lycopodium. The position. मैं ऊपर लाना है, उसके नीचे होना. For that purpose, she is shopping. So when all these are matching, why won't I go with symptomatic approach again? So I thought I kept lacanium like that. I will see whenever the constitutional should be given. So I thought of, I first have given lycopodium 200. This also, then now lycopodium is very deep acting. So I had another doubt whether to give during the menses, during the pain, or first I need to give something for the pain. So naturally, first I thought I will be giving something for the pain. So I have given my phospholocene and blah 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 remedies I have given. Naturally, she did not get any relief. So first cycle after my prescription went like that. No change at all. Naturally, everybody after 2 hours of long case taking, people will feel that I will be giving some miraculous remedy. So I lost there. So then I thought that no. I will go with the lycopodium remedy because lyco is certain deep acted remedy. So while giving lacasis lyco, I will take a pause like that. So I have given lycopodium 200 during the periods. In the next cycle, that is in the second cycle after she came to me, miraculously, within the first dose, within 1 hour of the first dose, she did not take any allopathic medicine yet in that cycle. She is planning to take allopathic medicine, but first she has popped up with these pills of lycopodium. And within 1 hour, she is happily moving all around the home. She's laughing with tears. She's not like the painful person anymore. And her husband is asking, hey, what happened to you? तुझे क्या हो गया? कुछ mentally कुछ हो गई है क्या तुझे? ऐसा, no, I don't have pain, I don't have pain, So that is what is her expression after lycopodium. Within 1 hour after lycopodium. So naturally, she have not taken any medicine other than lycopodium. So I thought that lycopodium may be her constitutional also. So I've been waiting. Since 2022. She even suffered COVID after that. Scan in March 2022 after 3 months. पहले हमें 2021 फरवरी का स्कैन मिला, फिर कोविड पूरा खत्म हो जाने के बाद 2022 मार्च में स्कैन किए थे, तो क्या हुआ? डिफ्यूज एडिनोमायोसिस. Remember, it was extensive adenomyosis before, but now it is diffuse adenomyosis. That means her symptomatic relief is not completely matched to the scan like in our previous case. Okay, so it is still there. Diffuse, because she is already in 43 years, na? That is why. Diffuse adenomyosis in posterior myometrium only. Earlier it is posterior and anterior also, but it decreased significantly in the anterior wall and in the left anterolateral wall when compared to the last scan. This is what is the doctor has given. But fibroid also, see, fibroid is 29 into 15 into 15. Now it is 13 into 14 into 14. Half of the fibroid has gone. She is suffering with fibroids since 18 years. It is growing and growing and growing. But now it has come down. Half of the fibroid size has been come down. The endometrium is normal, 6.9. Her TSH is also normal. She doesn't have any thyroid problem. Then follow up it with placebo and with thiocinaminum 3x and ferromet, because anemic is also there. And her cycles became regular, once in 28 to 33 days. Earlier it was 45 to 50 days. Now it is 28 to 33 days. Earlier it is 10 days discharge. Now it is only 4 to 5 days. Earlier it is 5 pads per day. Now it is only 2 to 3 pads per day. Pain to completely decreased. Pain is completely decreased. So she suffered COVID and some intermittent medicines have been given for COVID. Then on 14/6/2022, June 2022, after 6 months of our treatment, her scan said that adenomyosis only slightly present attached to posterior wall. Adenomyosis only slightly present attached to posterior wall, and her fibroid is 8 into 10 into 10. From 13, it directly 8 ho gaya, still decreasing. Then what is the follow-up for her? She had acute pain in the right leg and right knee. So this is our concomitant symptom. This is our proving symptom. This is our proving symptom that lycopodium is working. Okay. She had acute pain after 6 months without any reason. Right pain mein, right leg and knee joint mein pain aaya tha, not able to step out at all. So then what we will do? Naturally, I have repeated Lyco 200. That's all. Not Lyco 1M here. Because lycopodium is a deep acting remedy, we need to check. So Lyco 200 has been repeated, and slowly she is free from all of the above symptoms. And final scan with me was on 23rd, 2023 January 3rd. So 2023, after I think about 12 months, I suppose. Okay. So no adenomyosis at all. Dear doctors, please note this. No adenomyosis at all. And the fibroid is also seedling fibroid, only 4 mm. That seedling fibroid will automatically resolve itself only. And we are already speaking about hemangioma, right? No hemangioma in liver. No gallbladder polyp at all. The kidneys are also normal. All pathology gone with one shot. This is called constitutional prescriptions. Okay, this is called constitutional prescriptions. But here I have selected what? Symptomatic approach. The PQRS, the concomitants, the sites, the thermals, the physical generals, the mental generals, and the concomitants have given me this remedy, right? So this is about our second case. So shall we move to the case number 3? Okay. So a patient in her late 40s came to me in 2022 with acute. Yes, Dr. Alka.
Actually, we are beyond time. It's almost 10.
Yes. So what should we do?
We continue with another session.
As you wish. If people are very
Because
good with
you have 7
another
cases and we are all interested
Yes,
in learning, certainly.
Oh, okay.
So,
So
doing
out of the
justice.
Okay, so I will just let you know about one out of the box case. Then
Yes.
we will keep the other 4 cases, that is 2 chocolate cyst case and 2 cases of adenomyosis where I was struck very much, and where I have been very, very difficult cases. Okay, that we will discuss in the next session. But I will let you know one out of the box case. Okay, because I have promised you to tell that out of the box case. So this is this case. Case number 5 is out of the box case. That is about adenomyosis. What is here out of the box nature? So what did we learn till now? Adenomyosis will be coming in the reproductive age, or little less than that age, or in our 20s also. Now we have gone still further down. A 16-year-old girl who did not attend menarche yet. See, she did not attend menarche. Keep away of nulliparous. She did not even attend menarche, even after 16 years age. Came to me on 4th December 2018. Gynec, 4th December 2018, note that, okay? Gynec said that it's a rare condition, but she said that one important point, I had a doubt, she may have adenomyosis because the scan showed slightly rough endometrium, not as myometrium, okay? Adenomyosis happens in myometrium, but rough endometrium, and suggested some hormonal therapy to get her first menses. That is the point. At that point they came to me for homeopathy because she is the niece of my auditor. They generally came to me. Okay, but she is very lean, moody, often telling stories highly. Being the niece of my auditor, they came to homeopathy. I did not get any major breakthrough. Sibling rivalry is there because younger sister started menarche already. She is already 16, younger sister 14. So she had at that 12 years age only, but she did not get any menarche. So she naturally sibling rivalry is there. So she is not good with mother also. I only got one physical general symptom prominently, that she does not want to take bath daily and she feels bad to take bath, but no hydrophobia as such. वाटर से उसको तकलीफ नहीं है, बस लेजी है, डेली बात करना उसको अच्छा नहीं लगता है. She does feel bad about taking daily bath. Not only she doesn't take bath daily, but she feels bad also taking bath daily. That is the only symptom I got. So anybody, any guesses? Yes, Dr. Seema, you are exactly right. But so I thought of the antisoric remedy, not with that only one symptom. What I thought is, for any case to open up, here the gynec is saying something rare expression. So I have searched the Google at that time. At that time, ChatGPT is not there. So I've searched the Google. I came to know that even before menarche also, adenomyosis may be seen, but it can be seen like it is a rough endometrium only. So myometrium is not yet formed and not yet invaded. So it is shown in endometrium only. The line should be linear. The endometrium line should be linear in the scan, but it would be rough and tortuous in the scan before menarche. It could be like that. That was the study in Google. Okay. So I thought that, okay, that gynec also may be right. So for any case to be open, so we will give sulfur 1 dose, right? Sometimes if anytime we have been stuck there, so naturally people will say that give 1 dose of sulfur and the patient will naturally open up with her symptoms. That means whatever the vital force is want to tell, it will have an expression. But here I had a symptom concomitant of bathing also going to sulfur. That is why, because the concomitant is also there, I have given directly sulfur 1 ml. Otherwise, I would have given only 200. Because the concomitant is also there, I have given sulfur 1 ml. I only thought, my intention was, it would open the case for me. But it went way beyond. And the girl attained menarche on 23rd December itself. Only 20 days after our treatment. Can you imagine? It was a major blow to me. And I started learning in a different direction. Only after 20 days, she attained menarche. And her cycles were, okay, little disturbance is there, but she is having regular menses after that. After 23rd, she had her menarche and what? They are very happy, and it surely opened new horizons for me to understanding homeopathy. And I still remember the celebration of New Year on December 31st with them. 23rd means 31st के लिए 8 दिन तो हो जाते हैं, तो generally they will celebrate na monarchy, so they invited me for that function. So that was the first time I was spending December 31st night eve with that different type of function on that day. So that was the out of the box case. So I thought that then I have thrown away all the details like adenomyosis will come only in 35 to 50 or something like, no, it won't happen like that. It can happen at anywhere, anytime, anything. Okay. So this was the all of my cases. So sometime again, yes, we will take time. We will definitely take time sometime again when you are all of you are good with that. And these are some of my cases. And thank you for your patient listening. And thank you for the message. What is the thank you message? श्रद्धावान लभते ज्ञानम तत्परः संयतेन्द्रियः ज्ञानम लब्ध्वा पराम शांतिम अचिरेणाधिगच्छति. It says that one who is faithful, one who is dedicated to knowledge, and one who has control of the senses achieves knowledge and quickly attains supreme peace. Okay, so this is about Bhagavad Gita's this one. So knowledge is not free, madam. Knowledge is not free. You have to pay attention. Okay, so this line I've kept in my description also. I got attracted to that line. So now, thank you. And Dr. Alka, I have a request to you. So please keep my practitioners pack group link is there now in the chat box, so that if anybody are interested to learn, they can join me. They can join me with this Kingdoms webinar and okay. So that many of the people are outside iconic group, I suppose. So please pin that link in the chat box. I should have mentioned you before. I will send that link to you now. So you please pin that in the chat box. Okay.
Ma'am, I'll do it in the group. Should I put it in the iconic group? That will be better, so everyone would get to know.
No. Because many people, I think, are outside iconic group also today. So let them have that. And I think many of them are outside iconic group also. So I'll just send the link to you. 1 second. I forgot this. Yes. So I'm sharing this to Dr. Alka. And one more thing, I need to tell thanks for Dr. Priyanka Latkar and my son who helped me with the slides. Thank you, Dr. Priyanka, if you are there. So at the end, वक्त में मुझे बहुत कुछ help किए थे अपने slides के से. Dr. Alka, I have given that link in your WhatsApp. Please pin that in the chat box so that anybody wants to learn like this, they can associate with me. So right now we are having this type of learning in my groups. Okay. Of course, they are paid sessions. They will be, and I'm not advertising myself. I'm just informing you. Okay. And always be with iconic group, because it is a very, very prestigious women homeopathic group. So which is working, the people we are working selflessly to, you can see if you open the group. So anybody is having any question, and there is Shripriya madam ready with her rubrics, and any other senior is ready with the answers. Where can you see like this selfless help we are doing in this iconic group? So be members of this group and have good knowledge. Thank you.
Ma'am, just 1 minute. Let me just post this.
Yes, please.
We'll just hold on till the time. I request everyone to hold on till the time I post the link here. Yes, I think it has come. So anybody who would be interested in joining ma'am's lecture series, all are welcome. Yes, and it was a wonderful session. Certainly, we have learned a lot. not only about the pathology, but also about the remedies, and the cases were really insightful. Now, I love the way you ended the session. Yes, certainly knowledge is not free. And I'm sure that many of them were attentive and we have gained knowledge and look forward to learning much more from you, ma'am. So we will be continuing with this. We will be keeping one more session for the group for the rest of the cases. I will be putting, rather posting about the session in the iconic group. So all of you can rejoin again. Thank you, audience. Thank you, doctors, for being there with us till 11 o'clock almost. So see you once again next week, most probably. Yes. Thank you so much and good night. Thank you, ma'am.
Thank you, thank you. So I have stopped
ma'am.
my
Thank you so
presentation,
much.
right? Yes, yes, yes. Thank you, thank you, thank you, each and everyone participated here. I think some 45, more than 45 people have attended today. So people are thinking that recording will be coming. No, we have a scene here. We will not share the recording yet. Okay, so you have to attend in live only. So we are having recording, but we don't share the recording. Okay. Mm. Okay, okay. So recording has also been stopped. Huh? I don't think I have kept this or not. Oh, Rachana is recording, right?
Yes.
Okay, then we'll see that. Okay. Okay, then. So shall we move? Thank you very much. So now I will leave now.
And good night, everyone.
Good night, everyone.
Thank you, ma'am.
Thank you, thank you, thank you very much. So am I audible yet? Huh? So I think I need to stop sharing. Huh? Sharing to who I have stop sharing. Yes, now I can leave the call, right? Yes, dear doctors, we will meet again for the next cases.